If you're new to Medicare, you're not alone. Millions of Americans will turn 65 next year. Understanding all the options and the timing for open enrollment is critical. Joining me now is Gary Culp, Medicare Chief Distribution Officer with Cigna Healthcare. Gary, let's get right into it. What is the Medicare annual enrollment period and what are the dates?
The annual enrollment period for Medicare starts on October 15th and runs through December 7th. And it's a really important time of the year for Medicare beneficiaries to pause and look at what they're on today and what is really important to them and what they might need for the upcoming year.
Now, what are the different kinds of plans for Medicare beneficiaries to consider?
You know, a Medicare beneficiary can stay on original Medicare. They can actually wrap their original Medicare with a Medicare supplement to cover some of the benefits that original Medicare doesn't offer. But you know, 51% of Medicare beneficiaries today have elected for a Medicare Advantage plan. And they've done that because of the added benefits. Medicare Advantage plans offer all of what original Medicare offers and more. Many of them offer things like transportation, which would take you to and from a doctor's visit, prescription drug coverage, fitness programs, hearing, vision, and dental. All these are really important things, and many of them are offered with no additional premium.
In what ways is Medicare Advantage different from original Medicare coverage?
You know, original Medicare actually covers a lot of the inpatient as well as outpatient services. Medicare Advantage plans cover all of that original Medicare offers and more. And so really what sets them apart are the additional benefits, the things like I'd mentioned around transportation, prescription drug coverage, fitness, hearing, dental, things that are really important to aging Americans in terms of the coverage that they're looking for, well beyond what original Medicare offers.
Now, what should people consider when choosing their 2024 health benefits? I heard that Magic Johnson has been helping Cigna Healthcare convey that message to Medicare rookies. Can you tell us more about that?
Sure. You know, Magic Johnson's actually been a partner with Cigna for some time now. And what a lot of people don't know about Mr. Johnson is what he does outside of his amazing, history and career in terms of basketball. He's actually an entrepreneur that does a lot in the markets that we serve and helping individuals in terms of navigating healthcare and seeing options that are available for them. And what makes this a really unique time for Mr. Johnson is that he's also aging in or becoming eligible to the Medicare program as well. So he considers himself a rookie because he's trying to figure out what it is that he needs to look at in terms of his Medicare options as he's aging into Medicare as well.
Where can our viewers go for more information?
You know, there's a few places to go for information. So one is at Medicare.gov. That's where Medicare information can compare plans in terms of local market. But Cigna also offers information at CignaMedicareInformation.com, where we can actually help in terms of the options that are available within your community as well. And then we also have representatives that are available via phone. So, Medicare beneficiaries can actually talk to us and walk through what is the best option for them. And that's a toll-free number at 1-877-349-2897.
Thank you so much for joining us today.
Thank you.
For more information, as Gary said, head to CignaMedicareInformation.com or call the number right there on your screen.